Good afternoon, and thank you for allowing me.
Can you please speak a little more directly into the microphone? Microphone on, please. We need audio at the podium.
Good afternoon, and thank you for the opportunity to address the advisory panel this afternoon. My name is Mike Fitzpatrick. I represent the 8th Congressional District of Pennsylvania. And we'll begin by thanking you for holding this hearing, as well as for the agency's ongoing commitment to use its full range of tools and authorities to expeditiously review candidate therapies for rare but devastating diseases like Duchenne muscular dystrophy. I'm a member of the Congressional Rare Disease Caucus, and I've discussed and advocated for funding and research opportunities for a number of medical conditions, many of which have connections to my district in Bucks County, Pennsylvania. That connection for Duchenne muscular dystrophy is 15-year-old Jake Wesley, who suffers from this terrible disease. Sadly, like so many in Jake's position, the decline of his health has been precipitous. The risk of doing nothing for someone like Jake is unacceptable. I've seen his disease progress year after year, robbing him along the way of any sense of his own independence. Jake deserves better. There is a path forward, one which could alter the lives of all Duchenne patients in a very positive way, giving them a chance to live a longer, better life. As you know, in recent years, the Congress, along with the FDA, have made tremendous progress through the Food and Drug Administration's Safety and Innovation Act, providing new therapies intended to treat persons with life-threatening and severely debilitating illnesses, especially where no satisfactory alternative therapy exists, in this case, Duchenne. The accelerated approval pathway outlined in Section 901 of the Act allows demonstrably safe therapies that treat an unmet medical need and appear to be efficacious, even with some uncertainty, to avoid the years of regulatory barriers and become accessible earlier to patients who otherwise have no other option. FDA has been most successful at applying flexibility in oncology and HIV/AIDS to speed patient access to apparently safe treatments, but the need and the opportunity to adopt innovative and flexible approaches to the review of rare disease drugs has never been greater than it is today. Children like Jake are waiting. That is why today my urgent call is echoed by 108 other bipartisan members of Congress who've joined me in writing to Dr. Janet Woodcock, and I would ask, with the panel's permission, that this letter signed by 108 of my colleagues be entered as a part of this record today. I remain committed to ensuring, and it's difficult to get 108 of my colleagues to agree, but